This is Kat Camerood. I'm giving my oral presentation for AGR 550 on how to instruct owners to give insulin injections to their animals. So first of all, insulin is a medication that is given to animals that have been diagnosed with diabetes. This is a condition where the body does not produce sufficient amounts of insulin, which allows cells to put glucose into them to be used for energy. Diabetes is diagnosed through a blood test, which shows increased blood glucose, and then if it's been going on long enough, high glucose levels in the urine. Clinical signs of this would be increased eating and drinking, increased urination, and weight loss. And like I said, blood work will be used to confirm this diagnosis. Insulin shots are given subcutaneously, which is in the animals between the top layer of the skin and then the lower layer of the muscle. It's not given orally because the digestive tract would break down the oral insulin. Insulin is measured in units of insulin per milliliter and given in U40 or U100 syringes, which are very tiny. And you also need to make sure when you have an animal that's diagnosed with diabetes to be more observant about the amount of food and treats that they're getting per day so that the daily calorie intake is consistent to be sure that the amount of insulin given daily for the animal is the correct amount needed for their calorie intake. You also need to watch for signs of diabetic ketoacidosis, which include excessive thirst and drinking, increased urination, especially with lethargy, weakness, vomiting, increased respiration rate, and decreased appetite. Also, be sure to give insulin after the animal has eaten and record the time of injection to be able to track to be consistent with the time given. So typically, for the sake of education, this is an insulin bottle. You will gently roll it to mix up the insulin molecules in the bottle and tip it upside down to mix it. If it's Vetselin, it's indicated that you shake it. So this is going to be the needle. So you're going to take the cap off the needle, take some rubbing alcohol and wipe it on the top of the bottle to disinfect it. You're going to tip the bottle upside down, put the needle in, and then pull back on the plunger of the syringe to pull back more than you need, as indicated on the syringe, and then you're going to push the insulin back into the bottle to whatever the amount you need. Pull it out, set the bottle down, put the cap back on your syringe to grab your animal. So then you're going to grab your furry friend and gently tint the skin so that you can get in the subcutaneous tissue. You're going to use your dominant hand, and you're going to, at a 45-degree angle, put the syringe into the subcutaneous tissue, push it in, let go of the tint, and then pull the needle out. Also note, be really careful when injecting the insulin into the subcutaneous tissue to not push the needle too far so that it goes through your really thin layer of subcu skin, and then you would just inject the insulin onto the top of the fur, and that's not doing any good. Put the cap back on the needle, and be sure to throw the needle away into the sharps container that will be given to you, so you'll just properly dispose of all of the needles to be sure that it's not a hazard. Thank you.